Hello again, ladies and gentlemen. Welcome to today's seminar entitled Guide to Publishing in Top-Tier Medical Journals. It's a pleasure to have you with us. We will start momentarily with the presentation. First of all, we will talk about how to start writing, tips for drafting a manuscript, recommendations by the International Committee of Medical Journal Editors, preparing and evaluating case reports, medical publication and research ethics, and selecting the right journal for promoting your research. So publishing is a highly fulfilling and rewarding process. It's a very important component of an academic and a career in science. However, it does present with a number of challenges, and today's presentation is aiming at helping you face these challenges in an easier or the easiest possible way. So you will hear about several tips on how to go about achieving this goal, which is important for your career at many different levels. So although medical research receives the highest funding, about half of medical and health-related research studies remain unpublished, mostly because of the challenges that you have already faced or are aware of. Part of it is lack of awareness and the tedious nature of the publishing process, the challenges it presents with. Just to give you some examples, the New England Journal of Medicine, one of the top-tier journals, publishes only about 5% of the 5,000 research submissions received each year. JAMA, Internal Medicine, another top-tier journal, receives about 3,000 submissions each year and has a 13% acceptance rate. However, manuscripts that get rejected from one journal can get accepted in another one, and often this is repeated several times until a manuscript finds its home, if you wish. One of the studies by Okiki et al. Found that in 5 years, 76% of manuscripts rejected by the Journal of Bone and Joint Surgery got published in other journals. So it is really important not only to prepare a robust manuscript for your high-quality research, but also to choose the appropriate journal that will be interested in publishing it. Some more facts about publishing. Here in this graph you can see how the number of publications increased during the time period 1996 to 2017 in different continents and parts thereof, and you'll see how North America and Asia as well as Western Europe have really increased drastically the number of publications in medicine that are coming out every year. So the competition is high, and ensuring high quality in both the research performed and the manuscript that is prepared itself is very important in order to meet this competition and achieve a publication in a high-tier journal. In this slide, you see data by country. So you see the H index, which we will talk about shortly, and the sites per document in this graph, and how many publications from each different country. So you see how the United States comes right at the top, but also countries like Canada and increasingly China are becoming more competitive in this arena. So there's many different parameters that are being considered, not only how many publications are coming out from a country or from an individual, but also how many citations these publications are receiving and what other metrics characterize them, such as the H index. So how do we start writing? Let's go through some tips, useful tips for drafting manuscripts. First of all comes your research, as you can see on your top left corner. You collect or you perform your experiments or collect your clinical data, do your statistical analysis, and then you prepare your manuscript. And this means composing the text, preparing the figures, preparing the tables, having all this information together. Choosing the right journal for your work, submitting it, and then going through the peer review process. Initially, this is assessed by the editor, and if it's judged suitable for the journal, it's sent out for peer review. From there on, it may get accepted, which means a big success for you. It may go for several rounds of revisions, which is very, very common, or it may get rejected, which is sometimes even more common than the going straight through for revision. So in the rejected scenario, one goes back to choose another journal and go through the process again, hopefully after optimizing their manuscript more to increase their chances of success. So let's start from the beginning. When it comes to structuring an academic paper, you need your title, which needs to be brief and to the point, a title that will reflect the content accurately, but will also attract attention and welcome the reader to read along the rest of your manuscript. You need an abstract that will accurately describe the work that was performed, will attract attention, and this is very important because it is the abstract that will help the reader decide if they will go on to read the rest of your manuscript or if they will move along to another manuscript. And remember that in the science world, everyone is very, very busy. Making the decision to read a manuscript, a paper, a publication, is making the decision to devote some of your precious time. And you do this if you know what you will be reading is of high quality and high interest and high impact in the scientific field. So the importance of your work needs to be reflected in your abstract without unnecessary details, but with sufficient information to reflect what's coming in the main text. The introduction would include literature review, hypothesis, research questions. It needs to be fairly concise and to the point. Usually we don't want it to be more than 4 paragraphs, but all this depends on the journal where you will be publishing. Then comes the methodology, where you need to describe what was done and how. This is also a very important component. This is where you have to describe exactly what you did and how you did it in a way that anyone will be able to reproduce it if they read your methodology. So the introduction needs to capture the attention, state the facts, explain the rationale for what you did, the scientific question you're going to address, and why your work was important, and they will be investing well their time by reading your manuscript. And then your methodology is putting the scientific methods in place so that the readers, the audience will know exactly what you did and how. The results is a very important part. It needs to accurately describe what you found without any bias, without any subjectiveness. It needs to be objective, a clear description of what was done, what you found. So caution needs to be taken not to have overlapping information in the part of methodology and results. Methodology is the technical part. In the results is what you found from the flow of work that you followed. Each component of your work is described in a different part of the results, and the flow of the results does not necessarily need to be in the chronological order that you performed the work. More important is to have a flow that helps the readers understand the rationale of the work and how and why you moved on from one type of experiment to the next, and how the results from one set of experiments helped you move on to the next set of experiments, and they complemented the rest of the work. So this is the part where you need to show how many replicates you use, the statistics that demonstrate significance, to have clear figures, clear tables, no bias in what you're presenting, different sections for different types of findings, and some helpful comments so that the reader can appreciate what it is that you saw. Now, in the discussion comes your interpretation of the findings. What do these findings mean? How do they compare with the literature? How do they help answer the scientific questions that you raised during your presentation? And at the end, of course, we have the conclusions. Citations, references needs to be throughout your presentation. Very important to always keep in mind the format that your journal is requesting. This means having decided in which journal you will be publishing. So this is a first decision. In which journal will I first submit my manuscript? Follow the guidelines. There's always a very clear guide to authors with detailed information on how to prepare the format and the size, both of your text as well as your figures, tables, and anything else. In the guide for authors, you will also find information on the submission procedures, the fees for publishing, copyright and ethical guidelines. Make sure you adhere to all the instructions. This is the first and foremost step to avoid rejection. So the abstract should not exceed approximately 300 words. Avoid giving too many details. There are two types of abstracts, structured and unstructured. The journal you choose will give you this information. Try to present, to use in the present tense, so present your data in present tense while writing general facts or findings. Well, you can use past tense for the actual results. Try to have in your abstract the important keywords. This will help readers, interested scientists, to find your abstract in the literature. Avoid jargon, acronyms, abbreviations. And avoid too much background information. You just need a sentence or two to set the stage, what it is that you're talking about. What's the background in just a sentence or two that makes your research meaningful, pertinent, and cutting edge, if you wish. You also do not need to place detailed description of methods in your abstract. Just a sentence, again, a sentence or two of what you did, just to give a broad idea of what this paper is talking about. And very important tip, always write the abstract at the end of drafting your research paper. Why? Because it is at the end that you will have a good view of what goes into your manuscript eventually. Sometimes the ideas we start with differ from what we end up putting in a manuscript. So first write your manuscript and leave the abstract for the end. Some more information now for the introduction, and I would like to give you some more tips for the method section, results, and discussion. So the introduction should provide the general background, as we mentioned earlier, introduce the topic of your paper, highlight novelty and importance of the study. This is crucial. This is what will attract readers to your manuscript and will keep them interested so that they keep reading past the introduction to your actual results and discussion. Describe the research problem clearly, because remember, not all the readers will be from the exact same field as you are. So make sure that you describe clearly the background and the problem that you went out to tackle with your research. Best not to exceed 4 paragraphs, but always check with the instructions of the journal. And remember, very important, don't just state that your work is important. Show the information so that the reader can appreciate that it is important, not just because you use the word important, but because the facts that you provide them with reveal the importance of your work. Now, method section, as we discussed, have to include a description of the study site, the time of data collection, the protocols for collecting the data, the details of any experiments or sampling design that you used, as well as details of any computational research methods that you used. If you have used different organisms, they need to be described, how the data were analyzed. If you've used different reagents, chemical reagents, they need to be mentioned as well. Remember, this is the section that needs to be clear enough for anyone to be able to reproduce and validate your data if they want to. This is very important in the academic field. Results. Crucial part, this is where you actually show off, reveal what you have done, always in a very objective manner. If you're a PhD student or a student of any kind, keep in mind, a publication is not where you put all the results you have generated during your work. No. The manuscript is where you present all the data that are relevant to the research questions that you will be talking about and addressing in your manuscript. So these are the research questions that you outlined in the introduction. This is very important to keep in mind. We present the data that address the point, the question that was raised. The data, apart from text, can include graphs, figures, or tables, or all of them, or some of them. The format, the exact format of each one needs to be in agreement again with the requirements of the journal you will be submitting to, and be extra careful to read these instructions before you prepare your graphs, figures, or tables. A conclusive statement on the entire study is very useful to have in the results section, but this is just a statement, not a full-blown discussion, and this is where you need to be careful to ensure that the content of the results section differs from the content in the next section, which is the discussion. So the discussion needs to be carefully structured to keep it interesting, informative, and to demonstrate the importance of your observations. So whereas in the results you describe what you observed, in the discussion you discuss the meaning of what you found in relation to the literature and based on your critical thinking. Each paragraph is very important that it has only one central idea. Usually what I advise is to have an opening statement in the beginning, an opening sentence, and a closing sentence in every paragraph. The opening sentence will state what the topic of this paragraph will be, and the concluding sentence will state the conclusion in relation to the specific topic of the paragraph. And this conclusion will be based on your research findings. It's really beautiful in a discussion when the writer succeeds in ensuring a smooth flow from one paragraph to the next. So one paragraph needs to start conceptually where the previous paragraph finishes, so that each one ties to the previous and the next one in a very smooth, seamless, logical fashion. The concepts need to be built one by one gradually so that the reader can appreciate why and how you went on from one small question to the next until you fully addressed the big scientific question of your manuscript. So remember to mention the research questions being addressed, the hypothesis being tested. Highlight the significance of your data, not by saying that it is important, by providing the references, the background, the information to demonstrate that it's important, to prove that it's important, and discuss how this helps progress knowledge in your field beyond what other publications had gone so far. Highlight the important trends and make sure to include some comparisons with other similar or previous studies that have been performed. Indicate whether the hypothesis is supported, rejected, or partially supported by your work. And let me clarify here that it's not wrong if your data end up rejecting a hypothesis. If this is what the reality is, if this is what you observed with your objectivity and your experiments and your analysis, then this is what you should state. It is the truth that we're seeking, the scientific truth. At the very end of a manuscript, the conclusions should contain a brief summary of the scope of the paper, topic and research aims given in the introduction, but in a very brief fashion, reiteration of the most important findings, and a concluding statement about how this topic relates to its context and to the wider field surrounding your research. Don't forget in your manuscript to include your figure legends and table legends and your references, your bibliography, all of which should, and I'm repeating this again and again because it's important, should be according to your journal's guidelines. Okay, let's look at the recommendations by the International Committee of Medical Journal Editors. This information, these recommendations are valuable when it comes to preparing a high-quality manuscript. And after some practice, it becomes easy and part of your daily practice to include these recommendations. So these were developed to implement best practices and ethical standards in the conduct, report, and review of medical research. They were framed to help authors, editors, peer reviewers, and others in the field to distribute information that is accurate, clear, reproducible, and unbiased. ICMJE recommends that these guidelines should be followed along with individual journals' instructions to authors. And of course, you can find online the detailed recommendations. I would like, however, to make note on some of the key recommendations and specifically 4 criteria that are important in order for someone to be eligible for authorship, for example. This is one of the questions that can often come up when preparing a manuscript: who merits to be in the author list? So to avoid any misunderstandings, clear criteria are available to help us all communicate and be on the same line. So 1, substantial contributions to the conception or design of the work, or the acquisition, analysis, or interpretation of data for the work. 2, drafting the work or revising it critically for important intellectual content. 3, final approval of the version to be published. And 4, agreement to be accountable for all aspects of the work in ensuring that questions related to the accuracy or integrity of any part of the work are appropriately investigated and resolved. In regards now to conflict of interest, it is important that all authors disclose all financial and personal relationships that can possibly bias or be seen to bias their work. For peer reviewers, there is also an issue of conflict of interest that needs to be clarified before undertaking this review or any review. So they're expected to disclose any conflicts of interest that could bias their opinion, and the same of course holds for editors and journal staff. Now, some tips for authors in regards to submission and peer review. In general, it's best to avoid publishing in predatory journals. Evaluate the integrity, history, practices, and reputation of the journal to which you will choose to submit your manuscript. All this is important in coming to choose your journal. You can find guidance from various organizations such as the World Association of Medical Editors, where you will find characteristics of reputable journals. Also, it's very useful, especially if you're in the beginning of your scientific career, to seek the assistance of experienced individuals in your field, such as your scientific mentors, senior colleagues, or colleagues who have more experience in publishing than you in the same field. There's many, of course, criteria that come into choosing the right journal, and we will discuss these in more detail in the rest of the presentation. Journals should maintain, and high-quality journals do maintain, confidentiality, which means that your manuscript is safe and the information will not be made available to others. It will not leak before it is published. Timelines. Top-tier journals are very careful to ensure timely processing of manuscripts using the available resources. The peer review is conducted by experts in the field who are not a part of the editorial team, who should not, of course, have any conflict of interest, and they work in an unbiased, independent fashion in order to provide their critical assessment. Integrity is also another very important factor. Editorial decisions should be made on the basis of the relevance of a manuscript to the journal and authenticity and quality of research. So this is something to keep in mind when choosing your journal, the relevance of your work to the general concepts, to the general field where this journal specializes. Journal metrics. This is something that many people take into consideration when choosing the journal they will be publishing in. The metrics of the journal are often used as a way to appreciate the significance, the impact of this journal in its scientific field. And the impact factor of the journal is often requested and used in CVs, in your bio sketches. So journal metrics, although they're often considered more important than they should, it is a critical factor, at least at this point in time, to take into consideration. It will make an impact on your CV, and it will be viewed and considered by your future employers. When it comes to peer review, it's important for an author to know how the peer review process will take place, because this helps one prepare their manuscript accordingly so as to facilitate the peer reviewer to offer a more objective evaluation of the manuscript. So the peer reviewers should maintain confidentiality and avoid premature disclosure of the manuscript's detail. They do not publicly discuss authors' work, and they must not misappropriately use authors' ideas before the manuscript is published. They should not retain manuscripts past the duration of the reviewing process, and they should respond promptly to requests to review. So reviewers can be any experts in the scientific community internationally, and they're chosen by the editors. It is important that they communicate in a constructive, honest, and polite manner. Although exceptions are encountered, we all try to meet these criteria, and this should be the experience you will have on most, if not all, occasions. Reviewers who cannot respond in a timely or objective fashion, or they have conflict of interest, they are encouraged to decline reviewing a manuscript. So let's look at some tips on how to prepare and evaluate case reports. Case reports serve the purpose of providing essential sources of information for better care of patients as they enlist important scientific observations that are not evident during clinical trials. Case reports serve three primary functions. 1. Identify new areas of research for verification in subsequent observational studies and clinical trials. 2. Documentation of rare or unusual natural experiences that cannot be replicated. 3. They provide clinical material to medical professionals, researchers, to revisit noteworthy lessons. So, what qualifies for publication? Cases that qualify are those that were previously unreported, unreported observations of a known disease, unique diagnostic procedures to diagnose a disease, or previously unreported complications resulting from a procedure. The structure of a case report, and this is a useful slide to keep in mind. The abstract should be a short summary of the case. Keywords, 2 to 5 keywords that assist in searching for the case report. And as we mentioned for all scientific publications, keywords are very helpful in attracting the readers who are interested to read this type of work on your topic. It helps them find your manuscript, your publication. So keywords are worth devoting time to pick and ensure that they reflect the content of your manuscript. Now back to case reports. Introduction should provide some background of the disease, of the patient, also how the patient was encountered. How did the patient present? And then we go on to the diagnostic focus and assessment. What were the steps that led towards the diagnosis? What was the thought process, the test results? And move on to therapeutic focus. What therapies were tried? What were consultant recommendations? What worked? What did not? And then what was the final result? Adverse results noted. How did the patient adhere to treatment? Now the discussion here will discuss the summary of the case and its results and the importance of the case, always in the context of existing information, literature, data that is out there, other reports that are out there, and always using your critical thinking, your critical expert opinion to tie your new findings to what was already known. The conclusion summarizes the case and states the important lessons learned. For a patient's perspective, you can present what was the patient's experience. And of course, very important, as always, when handling human specimens and dealing with patients, to state that the patient provided informed consent. And I will come back to this crucial topic of informed consent in some slides ahead. So a case report checklist. Does the diagnosis satisfy accepted criteria? Is the length of the case report less than the maximum allowed by the journal? Do all authors meet the ICMGE criteria for authorship? Does the report appropriately describe the patient's condition? Is the case distinguishable from existing literature? And of course, needless to say, this is a critical point in deciding whether your case deserves to be published in a case report or not. Is there unwarranted extrapolation and generalization? Or are you objectively describing what you observed? Are citations obscure, outdated, or inaccessible sources? Be careful of all those factors when you prepare your case report. And a helpful figure when it comes to deciding and evaluating your case report is this star here, where you need to consider if all the documentation is available, what is the educational value of such a case report, what's the interpretation of the observations, the objectivity, the uniqueness. By taking all these different consideration, taking all the different points into consideration, you can come up with a score that will help you decide about the value of a case report. Now, coming back to the research participants. Dealing with human subjects in the research arena, medical research arena, is a very sensitive issue and falls under many crucial regulations. So it's very important to abide to all necessary regulations before starting your research, and I'm stressing this, before you even start your project. It's very important to lay the foundations for the protection of all the rights of the individuals who will be encouraged to participate, who will be enrolled in your study. And this is crucial both for their well-being, both for your scientific career, and in order to be able to get your work funded and published in the end. So, planning, conducting, and reporting human research should be in accordance with the Helsinki Declaration as revised in 2013. Approval to conducting research from an independent local, regional, or national review body is mandatory, and it will depend on where you're based and who is responsible for giving approval for the type of work that you will be going ahead to perform. It could be your hospital, it could be a national committee, it varies. Check, if you're not sure, check with your supervisor, your mentor, or people who are senior in your department. Patients' right to privacy should not be violated and informed consent should be obtained at all times. The process of informed consent is very specific. There's a lot of information out there on how it should be done, very strict processes that should be followed. Again, make sure that this is done correctly, and this has gone through a bioethics board and approved before you use it. The process of taking informed consent is just as important as the signed informed consent from your patients. Identifying information such as names, initials, or hospital numbers should not be published unless absolutely essential, and this again needs to be in agreement with the approval you have received from the bioethics board, and also with the ethics guidelines of the journal where you will be submitting your manuscript. Patient consent should be well documented and archived with the journal authors or both in accordance to local regulations. And informed consents you obtain, make sure you keep the originals in your records for the years ahead. These are valuable documents and should be well archived and protected. Journals often request, and they should request, informed consents when it comes to publishing work on human subjects. In the case of animal research, authors should declare adherence to institutional and national standards for the care and use of animals. And again, each journal will raise specific requests as to what information you need to provide if you have worked with animals. So, medical publication and research ethics. Let's look into that in a bit more detail because it's crucial in ensuring high quality of your work and therefore high publication success rates. Fundamental principles of research ethics, and this is a slide to remember. Honesty, objectivity, integrity, carefulness, openness, respect for intellectual property, confidentiality, responsible publication, responsible mentoring, respect for colleagues, social responsibility, non-discrimination, competence, legality, careful with animal care, and absolute maximum care when it comes to human subjects protection. Research misconduct is also an important topic that should be covered in the context of a talk such as today's talk. There are 3 key types of misconduct that should be avoided, and you should be very careful to note it, avoid it, and Fight against it if you come across it in your research career. This is fabrication of data, falsification of data, or plagiarism. All of them are very serious forms of misconduct and have very severe consequences in one's career. They can lead to losing your job, to being forced out of the university, and even forced out of a scientific field if such information is revealed about you. So fabrication, falsification, and plagiarism are really something to be careful to avoid, that it doesn't happen even by accident. Fabricating data or results and recording them, falsifications, manipulating research material or results, plagiarism is using someone else's research processes, results, or words without giving due credit. And because this is so important, please let me show you 3 slides on these specific points. So data fabrication means making up data or results to make the research study seem more novel or more important. It can be adding references to give arguments the appearance of widespread acceptance, although they're actually fake and/or do not support the argument. So it's making up data information that doesn't really exist. This means misleading your readers, misleading the scientific community, and it will have devastating consequences once revealed for anyone who does it. Falsification is manipulating your data, again, to show something that is not really there. Image manipulation in general is something that's permissible in order to improve clarity, but not, absolutely not to enhance or obscure results, to change them so as to show what you want to show, what you believe is there, but not what is actually there. So be very careful when manipulating your images for publication. Adjustments of brightness, contrast, or color are acceptable, but changes that hide things, obscure things, eliminate or misrepresent, or make things appear in your images, this is absolutely unacceptable. Beyond image manipulation, one can encounter also data manipulation, which means deliberately or unintentionally manipulating data to fit the hypothesis. For example, negative results, or omitting important facts to obtain the desired results. Again, this is unacceptable because it means misleading the scientific community and can cost the field years until they figure out what the reality is and get back on track. So this is why falsification is absolutely, and I'm repeating this, unacceptable and has a heavy penalty once discovered. Now, plagiarism is another unethical practice, which means plagiarism basically means using other people's words or ideas, copying them and presenting them as yours. There's also such a thing as self-plagiarism, which is also unacceptable, and it means using your own previously published words without acknowledging the source, so without acknowledging where you initially published them. So if something has been published, if something has been reported, and you are repeating it, you absolutely must acknowledge the source, even if the source was yourself. Plagiarism is a serious offense, and it has very serious repercussions, such as the ones we mentioned, including job loss, loss of reputation, even revocation of your PhD thesis, article retractions, all of which are obviously devastating for one's career in science. It takes different forms, from literal copying to paraphrasing someone else's work, and it can involve both data, words, phrases, ideas, and concepts. And make no mistake, In today's world, there are many tools out there that can very easily detect plagiarism and reveal it to the editors, to the peer reviewers, to the scientific community. So definitely never take the risk and don't let people around you take that risk. It's an unethical practice and a big no-no. A few more words on publication ethics. Transparency is very important. Where did the funding for your research and your publication came from? Any conflict of interest should be clearly stated. Any details like clinical trial registration number should be included. Anything that affects the research that you do needs to be clearly stated. Who funded it, who supported it, so that it's out there and people can judge facts as they appear. Authorship and acknowledgement, also very important. There are clear guidelines that should be adhered to by authors and editors. This is an important aspect of your work, and it affects directly your relationship with your colleagues. It's important to give credit to those who have contributed, either in the form of authorship or in the form of acknowledgements. And take that into consideration, weigh it carefully, make the right decision, and make sure that everyone is happy for the work they have contributed. Registering clinical trials, very important when this is what is described in your work. Clinical trials considered for publication should be registered in free public clinical trial registries. This is something that the journals you submit your manuscripts to will likely request to see. Now, back to this important point, medical ethics and informed consent. There's two types of consent, the implied consent and the informed consent. The implied consent means that no written consent was obtained. However, their patients were informed and they did consent in some way. Informed consent means that the patient or her attendant understands the mode of treatment or procedure. Someone from your team explained it thoroughly to them. And in the informed consent, they provide the authorization, permission to the doctor to act in a particular way, to perform specific tests, to obtain specific specimens, to perform certain type of analysis and collect certain type of information. All of these needs to be described, explained to the patient ahead of time so that they can decide if they want to participate or not. Informed consent must be voluntary, should be sought for most medical tests and procedures before going ahead with them. For invasive tests or tests and treatments with significant risks, written consent is required. So in most cases, if you're dealing with sensitive clinical information, biological specimens, or administration of treatments, you need an ethics approval by a bioethical committee. You need an informed consent. You need the person who is trained and knowledgeable on how to communicate the study information to the patient and obtain this informed consent. You can find a lot more information on ethics at the World Association of Medical Editors, as well as other resources such as the ones listed on this slide, COPE, Equator, ICMGE, and AMERBAC. Make sure that you're aware of the ethical aspects of your work before going ahead to perform a project, or of course before publishing it. Now, clinical trial ethics Adhering to good clinical practice guidelines is important. This is an international standard, and compliance with it ensures credible data reporting. The safety, confidentiality, and health of subjects is ensured. All NIH-defined or NIH-funded clinical trials need to follow the GCP, and GCP training should be renewed every 3 years. So if working with human subjects is something that you will be pursuing in your research work, following the good clinical practice and being trained on this is important and will be of use to you. The clinical trial registration policy: all medical journals should ensure clinical trials are registered in a public trials registry at or before the time of first patient enrollment, and this is a mandatory condition for publication. ICMGE accepts publicly accessible registration in any registry that is a primary register of the WHO International Clinical Trials Registry platform, and secondary data analysis of primary clinical trials do not need to be registered as a separate clinical trial. Authors are encouraged to include a statement indicating that results have not yet been published in a peer-reviewed journal. So this is some brief information about ethical aspects that relate both to work with human subjects, to science writing, and academic work in general. But now let's move on to another topic that will be very handy for you in your daily practice, in your daily research work. And this is how to select the right journal for promoting your research. And here are some tips to keep in mind. First of all, consider if the journal that you will be picking needs to be specialized in your field, or if you would prefer a more general science journal. Ask the question, who does your work help? Also, what is the outcome of your work? The novelty, the innovation. Will it impact people working in your very specific field or subfield alone? Or will it make an impact to the broader scientific community? Does the journal accept your type of article? Accept theoretical or applied research? Accept clinical or laboratory research? Does it publish open access or subscription only? Does it charge publication fees? All these are important considerations. What is the time from submission to publication? How long does the peer review process take in this journal? All these are factors that could be important. For example, if you're in a hurry to get your paper out because you know there's competition, then you need to pick a journal that has faster turnaround times, where you will get a response in a shorter period of time rather than a longer one. All these are parameters to take into consideration. Discoverability. Is the journal included in major abstracting and indexing services? This is important. When you publish your work, you want it to be visible to as many members of the scientific community as possible. So to achieve this, you need a journal that is registered in these major abstracting and indexing services. To give you some examples, you can look at the list on this slide. It is great if it is registered in PubMed, but there's many other sites where it can be registered, indexing services. As you can see here, Scopus, Web of Science, IEEE Explorer, Embase, etc. There's many different ones. Some are more well known and established than others, but all of these attract a large number of readers. So pick your journal carefully by weighing what is more important to you. How to assess the journal's quality? Because you want to publish in a high tier or a high impact journal, a journal that has high readership, so as to achieve the maximum possible impact in your scientific field and the maximum possible impact in your CV. Some considerations on quality criteria include: is the journal read by your target audience, people in your field? Is it led by an effective editorial board? Is it a peer-reviewed journal? And this is very important. This is an aspect that will be assessed and looked at closely in your CV, in your career, if you're publishing in peer-reviewed journals. What is the average citations of the manuscripts published in this journal? Do a lot of people read it, and do a lot of people cite the manuscripts, the publications in this journal? What are the journal's metrics? The impact factor, the eigen factor, and other factors you may want to consider. And I will come back to this point shortly. How does this journal rank compared to other respected journals in your field? Is it subscribed to by libraries internationally in large universities and academic centers? Does it have an ISSN? Is the publisher clearly mentioned? All these are important criteria to consider. And I'd like to give some more emphasis on the citation metrics. So, citation metrics serve as a measure of a journal, an article, an author, or even an institution research impact. And that is based on citations. So how many people refer to this work? This can be journal specific or author specific. And the journal specific metrics include the impact factor, the eigen factor, the 5-year impact factor, the immediacy index. I would say from personal experience, the most frequently used is the impact factor of a journal, and then comes the eigen factor, with all the others, of course, being important and taken into consideration. When it comes to author-specific metrics, in addition to the above, there's also the age index, which is increasingly used in Europe, in the US, and increasingly in other countries as well. The age index takes into consideration the impact factor of journals. Now, it's important to bear in mind that journal metrics do have certain drawbacks. So it's important to look at all factors before making a decision, because a high impact factor might not necessarily be the only thing that you're looking for, and many other parameters of a journal can be just as or even more important when deciding whether to publish in it or not. So just a couple more words about what the impact factor is, eigen factor is, and H index is. And before we move on, since the other factors will be about journals, let me pause here for just one moment and explain the H index, which is author specific, as we mentioned. It's often provided in people's CVs, and you may already include it in your CV. And the H index has to do with the number of publications that you have that has the same number of citations. So if, say, you have 30 papers published with at least 30 citations each, then your H index will be 30. And this is a simplistic way to describe it, but this is approximately how it works. It's the result of an equation, a mathematical equation. You can find it easily online. So it's a reflection both of the number of publications of an author, but also the citability of his or her work. So how many citations for the different publications. Now, in order to appreciate this, one needs to have a clear view of what the impact factor is. So let's go on to discuss this just briefly. The impact factor reflects the average number of citations to recent articles published in a journal. So if, for example, A is the articles published in 2014, B articles published in 2015, and C is A plus B that were cited in 2016, then this is how the impact factor is calculated, and you can see this here. This is very commonly used. However, they can vary greatly across disciplines, and new journals generally do not even have one for a certain time period. Impact factors can also be artificially boosted by journals, so sometimes they can be considered as a biased metric. However, they are still widely used. The eigenfactor is based on weight citations, and this is according to the prestige of the journal. It does not list journals that publish less than 12 articles per year, averaged over 5 years. And if a journal has an eigenfactor score of 1, it means that it has 1% of the total influence of all indexed publications. Keep in mind, eigenfactor is heavily affected by the number of articles published in a journal. So a journal that publishes twice as many articles compared to another, then it will have a much higher eigenfactor. So this needs to be considered carefully. Overall, promoting your research is an important aspect of your career. So choosing the right journal and publishing high quality, as many manuscripts as possible is definitely an important component. But these publications you then need to promote to the scientific community to make not only publicly available whenever possible, but also to use the different means of promoting your research so to attract as many readers as possible. You can create and maintain an online profile, engage in scholarly communication networks, build your own social networking profile, etc. There are platforms for medical researchers. GMed is a medical and social network for physicians only, helps expand your network and connect with physicians globally. This is something to keep in mind and consider joining. So just to sum things up, publishing your work is challenging, but is also fulfilling and rewarding. It's an integral component of a scientific career, a career in science, whether a basic research or clinical research. So make the effort to develop or even perfect the skills that will allow you to prepare high quality manuscripts that will show the quality of your research and promote this work. Achieve publications in as high tier journals as possible, and go ahead even further to promote through all these science networking tools available today the work that you do. Wishing you the best of luck. I thank you for your attention.